Welcome all to this special webinar event in collaboration with Vital Nutrients and Fullscript. I'm Amy Regan from Fullscript, and I'm so glad that you've joined us today. A few housekeeping notes. Please place all questions you have in the Q&A box for a chance for them to be answered at the end of this presentation. This webinar is being recorded, and the recording will be sent via email to all attendees and registrants, as well as available to watch at fullscript.com/webinars. There is a copy of the presentation slides in the files section. It is my pleasure to welcome today's speaker. John P. Troop, PhD, serves as the Chief Science and Education Officer at Vital Nutrients. As a leading industry expert with more than 25 years of successful category and clinical nutrition experience, Dr. Troop provides key insights on the innovation, selection, and use of Vital Nutrients products and advances educational insights to help practitioners and consumers select products to support healthy lifestyles. Prior to joining Vital Nutrients, Dr. Troop served as a member of the senior management team at several Fortune 500 consumer nutrition health businesses, Fortune 50, consumer nutrition health businesses, including Pfizer, Novartis, Nestle Wyeth, and Unilever. He also leads teams at several dietary supplement companies, including Metagenics and Standard Process. Welcome, John. It's so good to see you.
All right. Hi, Amy. Thanks for the introduction, and hi, everybody. It's really great to be with you. I'm always excited to have a chance to be able to share updates on some of the clinical science that we have, especially on trending topics as important as and as effective as the entire GLP-1 craze can actually be, frankly, right? But I think there's an opportunity to clarify a number of issues and to also talk about how to optimize the use of GLP-1 as part of a clinical therapeutic plan, but also to consider the importance and the differentiation, frankly, that a natural product that's a little bit more complete than a prescription med might be able to provide. So today I want to spend time really talking to you about the four things that are really important in being able to optimize the use of GLP-1 natural products and how that might even fit with and be complementary to the use of prescription meds. During the course of today's presentation, I want to be able to describe with you and talk to you about the GLP-1 system. We should not consider GLP-1 as a single one-off strategy or therapeutic. It really involves a cascade of hormones that then are able to reset and rebalance the metabolic system that then facilitates and can accelerate weight loss. And it's important to understand how that system works to be able to maximize the outcomes. In that way, we'll be able to learn how to balance the GLP-1 activation and receptor system for long-term and rapid response. And so the concern, as an example, that many patients may have with the use of prescription meds is can I go off of the GLP prescription med and what will happen? And we already are seeing that when patients drop off the use of GLP-1 prescription meds, there tends to be somewhere in the neighborhood of about 20 to 30% weight gain. And while there's still data that's emerging on that and helping us to better understand that, we also now know that if you have a more complete balance of the entire metabolic system, that issue of weight regain is really minimized. We can then use that information to look at and prioritize and better understand, frankly, what are the natural ingredients that can effectively activate the GLP-1 receptor along with the adjacent receptors that are so important to the GLP-1 cascade, which are the bitter receptors. And so at the end of the day, what I hope to be able to share with you is it's about a metabolic process that needs to be balanced, that uses a satiating effect as well as a rebalance of the metabolic system that is critical to long-term and healthy weight loss. So there are a couple of several issues, I really should say, that I want to be able to share with you today. And let me tell you what I'm going to tell you, and then we'll go through what it is, and then we'll summarize at the end. The first and starting point in realizing the utility and the significant effect that GLP-1 hormone cascade plays is first, I think, the understanding and even the appreciation for the fact that obesity is an insulin-resistant issue and it requires an underlying system change. The GLP-1 hormone cascade is critical to satiation and to metabolic balance. And GLP-1 doesn't act alone, yet it orchestrates a series of changes in hormone responses that control satiation and hunger, for that matter. But more importantly, in doing so, it also helps to reset the metabolic balance to provide long-term benefit and control. So for GLP-1, activation will improve insulin sensitivity, which is absolutely critical to metabolic process and to the ability to effectively lose weight. And at the same time, it does decrease food cravings, but it does so much more that we shouldn't be thinking about this, especially as practitioners. The GLP-1 is just going to stop my food cravings. There's more to the story. Natural ingredients will activate and sustain GLP activity. And here it's important to understand, how can you increase GLP-1? How can you increase the receptor activation? And that requires an understanding of the right nutrient ingredient at the right dose. And we'll talk about that. And the second issue is that to sustain GLP activity levels so that it can be more effective, it's important to prolong the availability of the circulating levels of these hormones. And that can be done by blocking an enzyme that many of you probably already heard about, called the DPP4 enzyme. And we're going to talk about that and how natural ingredients, appropriately selected, can block the enzyme, which will result in not only the activation of the GLP-1, but will increase its availability up to 2 and 3-fold times what you might expect to see in a normal diet. The third point that I want to share with you and spend time talking about with you is the GLP receptors and responses are predominantly in the digestive tract. And the reason why that's so important is that the activation or the release of the hormone and the activation of the receptors, about 90% of those receptors that have a metabolic effect and affect the satiety response are actually in the gut. So you can imagine, if you're using an injectable or prescription med, it's going to bypass the gut and go straight into the central nervous system. While there's a clear advantage in that, and it works, there's no doubt about that, the issue is the rest of the system will be ignored and actually downregulated, which at the end of the day, when patients stop taking the prescription med, that's why all the negative consequences and the weight regain will happen, is because the entire system wasn't orchestrated in a way to create optimal balance for healthy weight loss that can be prolonged. So we need to understand that the gut plays an important role, and that should be nothing new to all of us as practitioners. We know that the gut is core to the change of metabolic disease states, and there's no exception in this story. And so to understand that, it's also important that as part of the entire GLP-1 metabolic system and hormone cascade, part of the role is to make sure that the microbiome is reset, the production of short-chain fatty acids can increase. And the reason why that's important is that short-chain fatty acids, more specifically butyrate, will stimulate GLP-1, and higher levels and more sustainable levels can be achieved. So to do anything with a GLP-1 therapeutic plan without addressing the gut could be a disadvantage. There are also selected prebiotics that can play an important role, not only in stimulating GLP-1 and facilitating receptor activation, but also in being able to prolong the availability of this hormone. The gut-brain axis, as we've heard on a number of other different issues over the last several years, is also critical in the communication signal, and particularly related to mood and satiation and cognitive behaviors that are also important. And the fourth point that we'll spend time talking about in more detail is, again, this GLP-1 hormone cascade and the coordination of the result for a long-term system improvement. I think that if you have been interested in or practicing functional medicine or naturopathic medicine, where there's a therapeutic order or the functional medicine matrix, it's important to realize and appreciate that total system care is really an important advantage and an important approach to effectively manage the use of GLP-1 in the expected outcomes that you'd expect to see in patients and the results that patients are actually looking for. So these are the 4 critical points that we'll talk about, and then we'll summarize again at the end. What I'd like to do is also talk a little bit about what's the problem that we're trying to solve for, and maybe even more importantly, how did we get here? Like, what is this problem of this epidemic of obesity? And if we understand the causative influences and the causative factors that are leading to higher incidence and prevalences of overweight and obesity and even morbid obesity, then we have a better chance of being able to understand why and how we can solve the problem. So we'll talk a little bit about the epidemiological impact and public health issues that are important to understand and appreciate and manage around and through. From that, we'll then talk about the very specific mechanisms of action of the GLP-1 cascade in the metabolic system that's so important in being able to manage healthy weight. We'll then tease out the specific nutrients that can play an important role in combination that will maximize and optimize the effect of a GLP-1 focused strategy on weight loss and weight loss support. And then we'll talk at the end about clinical insights and then wrap it up. So here we go. So what happened in 1985? One of the first reports by the Center for Disease Control showed that the incidence of obesity in America was about 15%. Over the next 30 and 40 years, that gradually increases. You can see in these charts, these color charts, the darker the color, the higher the incidence and the prevalence of weight loss. And so by the time you get to 2023, we're approaching 60% of the American population is overweight. Close to 40% are obese. And a growing percentage of the population is morbidly obese. These are all candidates for GLP-1. And in fact, anybody with a BMI really over 29 or 30 would be good candidates for that. But what's happening? So 85% of Americans have liver and metabolic dysfunction. This is closely associated with the high rates of overweight and obesity. And there's a common issue to this. And it basically, what I prefer to talk and describe as glucose toxicity is glucose intolerance and insulin resistance. And so one of the key points that I think is really important to appreciate and then put in perspective why metabolic control is so important, and even more important than just reducing food cravings, is that basically obesity is a condition of insulin resistance more than it is of excess calories that are consumed. I'm not dismissing caloric intake, but the underlying causative factor that leads to the progression of overweight and obesity is really this issue of insulin resistance and glucose toxicity, and it starts in the liver. And so understanding how to fix that is an important consideration. And frankly, one of the reasons why you want to select a GLP-1 therapeutic program plan that basically directly involves influence on the digestive system and metabolic systems. We have 40% of Americans that are considered obese, as I mentioned, but it also has other metabolic consequences, including elevated HbA1c, resting blood glucose, and compromised endocrine control and response system. All these conditions can be addressed by managing GLP-1 to the insulin connection and cascade. So while it is true that GLP-1 can stimulate and advance satiating responses or decrease food cravings, the real solution, and all that, by the way, all that will do is decrease the number of calories that you consume. All that's important and supportive, but it's really important to realize that in parallel, and actually as a prioritization in the benefit of GLP-1, we should be talking about solving insulin resistance, because that's the key to better metabolic control and better metabolic balance. And you can't do that unless you find a way to influence the digestive system, the microbiome, its metabolic and central nervous system connectivity, and at the same time, to be able to find ways for cognitive behaviors like decreased food cravings. And we can do all of that with the right formulation that's possible through natural products. Nevertheless, everything that I've just described to you is the reason why GLP-1 has such broad and wide impact on a number of health conditions, particularly the chronic health diseases beyond just obesity and weight gain. So it's an important system that shouldn't be minimized. And while there is a fast-acting response that can result in rapid weight loss, it's important to realize is how to harness that rapid weight loss impact and be able to balance it in such a way that optimizes a very healthy approach to healthy weight and healthy weight loss. So how did all this happen? And so I shared with you the statistics, but the history of this rapid weight loss across America and frankly across the globe can be directly traced to a shift in the macronutrient profile or a metabolic handling of macronutrients, carbohydrates, fats, and protein. And there's a direct relationship that's been identified through years of clinical research that basically shows a direct effect of increasing carbohydrates results into increasing glucose intolerance or glucose toxicity that causes insulin resistance that leads to weight gain and obesity. It's an underappreciated correlation to the disease that now has been shown to have a direct effect. So this shift in the American diet that first was identified and discussed in the late 1960s and progressed over time to even worse levels is the major contributing factor. So again, it's less about the number of calories you're consuming and more so an unoptimized balance of the macronutrients. So for example, if you look at the recommendation of the American Dietetics Association, historically it's been 50% or more calories can be carbohydrates, 15 or less percent, usually 8 to 12% should be protein, and fat should be 35 or 30% and less. That macronutrient profile is what's contributed to the problem. And so with caloric excess, and so an imbalance in the macronutrient, that's the origin of the problem. And that's the link between metabolic system control, satiation, food cravings, and the ability to maintain healthy weight, or even so the ability to lose weight. And so it's all about carbohydrates, and the subcomponent of the high carbohydrate intake that's problematic is the increase in sugar. And so the American diet and food processing system over the last 40 plus years has resulted in an increase of calories coming from sugar, high fructose syrup beverages, to the point where we now know, and finally the USDA dietary guidelines are getting closer to where it should be, which suggests, and the evidence supports, that no more than 5% of the total calories consumed should be in added sugar or sugar. And so looking at the label is really critical to that, because in addition to using therapeutic approaches like GLP-1 and the GLP-1 system cascade that we're going to be talking about, it's also important to be working with patients to help them understand how they can shift their diet and their macronutrient profile to make it more ideal, so that some of the consequences post GLP-1 prescription drugs in particular can be minimized and frankly avoided. So there is a nutrient component. Food as medicine is an important trending issue that we need to be aware of. And that's the nice option and benefit of the natural product solutions that we're going to be talking about today, because it fits squarely in the middle of the use of prescription meds and the better and healthier dietary profiles that we need. So it's the best of both worlds that's possible to manage with these natural solutions. This is an epidemiological data that clearly shows and supports that shift in carbohydrates and high sweetened sugars. And so that macronutrient profile really shouldn't be ignored, even while there are therapeutic plan is being put together on the use of GLP-1. This is a data slide that further supports the use and the importance of diet and nutritional profiling, and patients should really be aware of this thing to minimize some of the complications that have been observed in the use, particularly of prescription meds. But as you use natural nutritional product solutions, it's also important, as I've already mentioned now, is to get that healthy dietary profile. And this slide really highlights those types of foods that will accelerate and progress the development of chronic diseases and obesity. And so patients should be fully aware of this, is that GLP-1 used in isolation is an incomplete story that won't optimize the results at all. And so the consequences of obesity and poor glucose control can lead to significant health problems and particularly obesity. And there's a whole host of comorbidities that are associated with obesity. And it's important to realize that solving this problem of obesity can more effectively be done with the use of these therapeutic plans. And what we're trying to solve for is not just weight loss, but also more than 40% of the American population has one or more comorbidity associated with being overweight or obese. And that, from a public health perspective, it's an important issue that we need to address. So by losing weight and by using an optimized therapeutic plan, it's possible to have metabolic control, which is so critical to reducing these comorbidities. Now, this is an important observation and insight illustrated in this slide. And what I want to be able to highlight here is with you the development of obesity and frankly the development of other chronic comorbidities like diabetes is not something that happens overnight. It takes typically 5 to 10 years of underlying system dysfunction to result in the progression and basically the diagnosis of a chronic disease state. And that disease state is primarily driven by the development of insulin resistance, reflective of glucose intolerance or glucose toxicity. And it's important to realize is that what we should be and what we are and what we should be solving for in the GLP-1 therapeutic plan and the GLP-1 cascade is basically the metabolic balance to improve insulin sensitivity, glucose balance, metabolic control, decrease food cravings, and then healthy weights and decrease weight. And so this progression over time can be captured soon. And there are some clinical protocol guidelines that we'll share at the end that shows what are the simple metrics and diagnostic tools that you can look at to identify who's at risk earlier on to capture it, before it progresses past year 5, before the first diagnosis is made. So the benefits of GLP-1, and my critical point here, is that it should be focused on total metabolic balance for best results. The sequence of events that I just described is illustrated in this sequence of events, but this sequence of events holds true for most of the chronic diseases, whether that's overweight or obesity, whether it's diabetes, or frankly, even if it's cardiovascular disease. And all of these sequence of events all lead to an inflammatory state, which is the underlying contributing factor to every one of these disease states. And so understanding this flow can actually help patients in particular better understand the importance of a total and complete program for GLP-1 management. So the key insights that I want to point out and share with you is that over the last 40 years, the incidence and prevalence of obesity in America has grown from 15% to 60%. That's so what, right? We all know that. But I'm hoping that we all appreciate that this trend is due to a shift in dietary macronutrients. And it's these changes in the macronutrient profile that have led to insulin resistance and imbalance of the metabolic system, dysfunction of the liver, even dysbiosis in the microbiome, and basically changes in cognitive behavior that have contributed to even faster weight gains. It's all related to the lack of glucose control, metabolic and hormone imbalance. And the flagship hormone that controls all of this is GLP-1. But GLP-1 does not do it alone. It's part of our hormone cascade that has a full metabolic control. And the result is healthier weight gain that cannot be overlooked and can't be looked at as, okay, I understand all these things that GLP-1 does. I just want to focus on satiation. That's an incomplete story that will result in an incomplete system reset and incomplete system balance that won't solve the problem of overweight or obesity, let alone the metabolic changes that are really going to be important for long-term benefit. So GLP-1 is the key hormone that plays an important role, but we'll talk about what the GLP-1 hormone cascade is so there's a better appreciation. Everybody talks about the GLP-1 receptor, but there's another receptor that's critical to the overall function for metabolic control, and that's beta receptors. So beta receptors, there are 35 beta receptors in the entire digestive system, from the mouth all the way to the gut and in the brain. And it's important that in concert, the GLP-1 specific receptors are also activated with the beta receptors. And so that will also provide an important insight in how and why the management for more effective results can be seen. Natural ingredients, we'll talk about this. There are natural ingredients that can do all of this for us, and it's important they can be provided in a convenient and a complete package, if you will, for convenient adherence and effective outcomes. GLP-1 levels, again, is not a standalone issue, but if you can combine specialized formulas to sustain its availability over longer periods of time, you'll have faster and more significant weight loss. And that's why understanding how to influence the DPP-4 enzyme, frankly inhibit it, will also help the effectiveness of any program. Specialized formulas can further support GLP-1 and digestive health and function, and by using a unique formula and combination of selective ingredients will result in the most effective outcomes. The results of what I'm going to be sharing with you today are based on almost 20 years of research and research collaborations with the Harvard School of Public Health, Erasmus Medical College in the Netherlands, and the University Medical Center in Utrecht in the Netherlands, the Joslin Diabetes Center, the Novartis Institute of Biomedical Research, have all developed these insights and have identified the solutions that we've been able to pull together today, and are based on the clinical insights and the clinical effect of the nutrients and the ingredients that we'll talk about on how to optimize the GLP-1 use. So with that, let's move to the mechanisms of action and understanding what this system is, and then we'll talk about what the solution is to maximize this. So again, it's important and helpful to realize GLP-1 has broad, systematic effects. It doesn't address just a symptom, and I frankly would consider food cravings as a symptom to a problem. But what we're going to be talking about today is how to impact the underlying system that leads to a symptomatic response and how to manage the system. And so to better appreciate that, we should realize the GLP-1 receptors and the GLP-1 hormones activate a number of organs and tissues in the body, ranging from the pancreas for insulin and glucose control, to the liver and the liver metabolic processes, to the brain, both it's a neuroprotective effect, but also in the limbic system of the brain, and the food cravings and mood states that are so important and that have a major effect on caloric intake alone. It also has cardiovascular and skeletal muscle benefits. And so you can see right off the bat that if you're just focusing on a GLP-1 receptor agonist that affects only one receptor area in the body, like the brain, it's an incomplete story. And so the slide portion to the right, or the illustration to the right of the slide, better illustrates the dynamic and more complete effect the GLP-1 release and activation of the receptors have. And there are two major issues that GLP-1 will have. Number one, it affects the communication and the receptors in the brain to reduce food cravings and have a satiating effect. And number two, it affects every metabolic system and a sequence and cascade of hormones that allow the metabolic system to be reset, to reduce insulin resistance, better control metabolic processes, whether that's glucose balance or fat metabolism or even protein metabolism. And collectively, it then results into the simple effect of reducing the craving to consume more calories, but more importantly, to help reset the balanced metabolic system that plays the biggest role and has the biggest impact in the ability to control, manage, and reduce weight. So what have I been talking about here? It's like, what specifically is this GLP-1 cascade? So GLP-1 cascade is perhaps one of the most important hormones that puts into place a whole sequence and almost like a domino effect of more appropriate hormone response that more directly influences and results in better control of a metabolic process. GLP-1 is the starting point, whether it's derived from food or from natural ingredients that are maximizing the GLP-1 release primarily in the gut. And that release and availability of the GLP-1 hormone circulates throughout the entire body to affect the receptors and the beta receptors in the brain, which are the satiating and even stress management centers of the brain, the limbic system. It affects the nervous system connections and the active receptors in the stomach. It has an influence on motility and transit time that's really important. It also contributes to satiating effect and metabolic processes, and it results in the release of other complementary and synergistic hormones that further affect the ability to lose weight and reset the metabolic system. The most important immediate action the GLP-1 has is that it results in an immediate and an early phase of an insulin response. That early phase insulin response is missing in most people that are overweight and obese and have underlying inflammation. And so the first real thing that GLP-1 will do when taken orally is shift the insulin response to the left so there's an earlier peak. And then it activates the satiation centers in the brain and the indirect satiation response because of the changes that take place in the stretch dynamic of the stomach and the stimulation and the activation of the hormone that's observed in the digestive tract. So when we're talking about and trying to describe GLP-1 cascade is the stimulation of the insulin release, stimulation of the satiation centers, and a reset of the entire body's metabolic process that facilitates and accelerates the ability to maintain healthy weight. So here's the cascade of the GLP-1 hormone system. And these hormones primarily are responsible for the balance of satiation. And so when we talk about critical hormones from ghrelin, which actually controls and influences the drive for hunger, the rest of the hormones drive metabolic processes and a hormone response that does everything from metabolic control influence to reducing the food cravings in the brain. And so that ability to reach multiple organ systems and tissues, multiple receptors, is dependent on not just GLP-1, but again, the orchestrated, concerted ability to influence a comprehensive set of hormones and critical steps in the metabolic process. As a result of that, understanding where the majority of the GLP-1 and beta receptors are located through the entire digestive tract, and I mentioned it starts in the mouth. There are GLP-1 and beta receptors in the mouth that start the process moving. It's important then to realize that the digestive tract plays a critical role in being able to maximize the effect the GLP-1 therapeutic process will take place. So even if a patient has decided, appropriately so, to take a GLP-1 receptor agonist or a prescription med, it can be enhanced by a co-therapy with a natural product because it's the natural product that's designed to influence the rest of the GLP-1 and beta receptors that are found throughout the digestive tract, as illustrated here. So we know where the most critical receptors are throughout the digestive tract, and we know which receptors are also available for the other cascading hormones, and also obviously in the pancreas, the ability to stimulate the insulin release. So this is an important insight and part of the rationale of making sure that a nutrient product solution is available that maximizes the response of the metabolic system, stimulated first throughout the gut. Again, the next important thing beyond the gut is basically the impact of these other organs, and particularly that's important is the brain, the satiation centers, the digestive tract, and the pancreas, or the critical other tissues, and the liver in being able to manage the metabolic process. And so to be able to do that, again, it's important to take and have an oral solution that basically gets to the gut and starts that process. We talked a little bit now about the activation of the GLP-1 hormone, how that happens, how it works as a cascading system, and affects satiation. I wanted to mention a couple things on the ability to sustain the availability of the GLP-1 hormone that's been released. And that's by being able to inhibit the DPP-4 enzyme that occurs in our system. And so here, it's important to realize that this DPP-4 will break down the GLP-1, and so it renders it basically useless. GLP-1 will be stimulated in the first 10 to 15 minutes of consuming food, or in the first 10 minutes or so of consuming a natural blended formulation. It can, however, disappear quickly within 90 minutes. And so that's really the issue. You want higher levels of GLP-1 to occur, and you want those higher levels to remain at sustainable levels for a longer period beyond 90 minutes. And by being able to inhibit the DPP-4, you can achieve that objective. So any formula should focus on inhibiting DPP-4 in conjunction with activating and releasing more GLP-1. And so that's an important consider when you're looking for a natural and nutritional solution is don't just worry about GLP-1 receptor activation. Think about activating and releasing more hormone, activating all the beta receptors, and inhibiting an enzyme that breaks it down. That results in more, faster, and long-term benefit on metabolic reset and healthy weight management. And this slide just further illustrates that by being able to inhibit the DPP-4 enzyme, particularly in the stomach and in the gut, is where all that happens. And if you're bypassing the gut and the digestive tract in a therapeutic plan, then you're going to miss that ability, and it'll dissipate faster and over time. So with that as a quick review and the mechanism and the insights on the mechanism of action, how and why and with what does it work, let's talk about the specific nutrients that can be responsible for the great effect and outcomes that we can see. The specific nutrients and ingredients that we're going to be talking about today are listed in this slide. We're going to be talking about the important role of resistant fibers, and particularly soluble and insoluble fibers. And a lead component is starch. We'll talk about exactly what does that do and why is that important. We'll talk about the really important use in the new clinical finding that postbiotics can play, particularly in the production of butyrate, which is an important activator of the GLP-1 hormone system. We'll talk about a probiotic that's really important in terms of further activating the food craving centers, or decreasing those actions. And at the same time, also its ability to improve mood states, which plays such an important role in cognitive behaviors. And one of the most effective natural products that are available is a modified hops extract called astaxanthohumulin, which are really critical because it plays two really important roles. It will activate the level or the release of GLP-1 and increase the level to high levels. And it basically has the ability to activate the GLP-1 receptors because of its chemical compound composition. We'll talk more about that. So let's quickly take a look at the ingredients and nutrients and some other nutrients that I've been describing that you've probably heard about. Again, the two primary centers that we want to be aware of in any selection of a product is one, can you have an effect on decreasing food cravings? That all happens in the brain. And can you have an effect on increasing the availability of the hormone itself? And can you have an effect on sustaining the availability of that hormone and expanding the cascade effect in the metabolic processes? The brain and the digestive tract and the liver are basically the three components that we're trying to target and to maximize the effect. Hops extract can do both, can activate both processes and influence the metabolic processes in both areas. Beta-caryophyllene is an important ingredient that also affects the mood centers and food cravings. A probiotic that is a GABA producer will improve the mood states and help support the decrease in food cravings. I might add here that the popular prescription meds of Ozempic and Wegovy have a single and only a single effect, in that they target the satiation centers of the hypothalamus and the limbic system on food craving centers, and that's essentially what they're limited to. And so a more complete story is basically in the use of hops extracts, resistant starch, which plays a key role in the stomach and in the digestive tract, and the prebiotics and butyrate production. So this is an illustration of what is it that you should consider, where does it work, and what the mechanistic effect are, and those are all well known and clinically supported. Let's talk a little bit about hops and the modified hops extract. The main standardized compound is a specific component called xanthocumolone. What's important about xanthocumolone is first its chemical structure. It has very similar chemical structures to receptor agonists and to those compounds that are able to activate the GLP1 and bitter receptors. We know that there's a fit, there's an isomeric fit that makes this compound effective. We also have data now to support the dose response in the pharmacokinetics. We know how long it takes once the xanthocumolone is consumed and how long it lasts. We know that it has an active half-life of about 40 to 60 minutes. And we know what the specific dose is, that it should be 6 milligrams per serving as the most critical level of activity to bring about an illicit response. Let's talk a little bit about resistant starch. And what's really important about resistant starch are really three things that are critical. There's a minimal clinical dose on the use of any fiber. If the fiber or prebiotic that's being consumed isn't at the level of at least 1.3 to 1.4 grams per serving, it'll basically have no effect on changing the microbiome and to be able to activate the GLP1 total system. The second thing you want to look for is a fiber and or a prebiotic that specifically can effectively colonize two key strains. Number one is Akkermansia, and the second strain that's really critical as a resulting benefit of the use of selected prebiotics is a microflora called F. prusnitzii. F. prusnitzii and Akkermansia can influence metabolic processes, and their real role is to influence metabolic processes and stabilize and reduce inflammatory processes more than its ability to stimulate the GLP1 receptors or to increase GLP1 production. That's really a secondary or tertiary response, and it's emerging data. Its real role is to influence a positive metabolic balance. And you want to look for two strains of probiotics that will colonize it. Taking a prebiotic will more effectively colonize Akkermansia than taking the probiotic itself. Akkermansia and F. prusnitzii are incredibly difficult to get to stabilize and colonize in the gut. And the most effective way you can bring that about is by the use of a substrate that is a fuel to proliferate the occurrence of those things, or to use a prebiotic like a resistant starch, or in this case, potato starch. The last thing that's important to realize that at the effective dose of an intake of resistant starch that it will do is that it will block the DPP4 enzyme and then further help to support the sustainability and availability of the GLP1 hormone. So the use of selected prebiotic plays a critical role and a core role in a GLP1 total system management. We've done additional clinical study ourselves, and we've been able to demonstrate in human studies that by using a blend of both insoluble and soluble fibers and also resistant starches standalone, the inhibition of DPP4 enzymes can be seen more specifically by increasing spike in GLP1 for longer periods of time. So we've demonstrated that series of links or that association. So it's not just about GLP1, it's about inhibiting DPP4 enzyme, and as a result, you should see higher levels of GLP1 and lower levels of glucose. The second important nutrient to consider is the use of postbiotics, or more specifically, a pro, or postbiotic, frankly, that are high butyrate producers. And it's important to realize, and maybe still underappreciated, but butyrate is an important component that influences positive gut health, gets rid of gut dysbiosis, and enhances overall digestive function so that metabolic systems can be controlled. And we've done a specific study on our formulation that specifically looks at the amount of butyrate that is produced. It's significant, as you can see on the left-hand part of this slide. And more importantly and specifically, we've shown a direct relationship in its ability to stimulate GLP1, increase its availability to have its then corresponding cascading effect and its effect on receptor activation. The next component that's really important as a complete and comprehensive solution are basically looking at probiotics that can support and further strengthen the satiating response, or the ability to decrease food cravings and to be able to keep that sensation of feeling full longer. And so satiation is an isolated effect, and it's further enhanced by positive mood balance if you want to have long-term effective decrease in food cravings, and so that fewer calories can be consumed, and basically metabolic processes can also be reset. And so it's important to also consider the use of, or finding a formula that includes a GABA producer. And we've now also been able to show that not only are high levels of GABA produced and available to the limbic center of the brain, it also stimulates the vagal nervous system communication center and sequence of events into the brain, and results into the increased production of serotonin. And we all know that serotonin is a happy hormone. And the reason why that's important is that it supports longer lasting satiating effects. So there's advanced mechanism of action for more complete and balanced support. The target is to be able to balance metabolic processes and satiation, and the critical ingredients of modified hops extract and the active compound of xanthocumolone, resistant starches, and the use of post and prebiotic can play an important synergistic effect. The last set of data that I want to share with you is the very specific effects that xanthocumolone can have on the result of GLP1. We've been able to now demonstrate, and in the clinical literature, we can also show that GLP1 levels are activated with availability of this modified hops extract. We also know that glucose response is decreased, and that healthy weight can be facilitated, as seen in this last upper right-hand corner. More specifically, we know that modified hops extract can reduce inflammatory response. It can also improve insulin sensitivity or reduce insulin resistance. And these are all important components that have now been clinically supported and demonstrated. Additional data, again, shows that the complete use of basically GLP1 activation system results in a more effective level of glucose control. We know that there's an early insulin response that can be seen because GLP1 activity can be increased and made more sustainable. And as I mentioned at the beginning of this presentation, is one of the most important and underappreciated effects of GLP1 today is that early insulin release phase that's missing in people that are overweight or have chronic inflammatory based diseases. And so this formulation, and particularly the combination of the ingredients that we've been talking about, result in that early insulin release. And you can better see in this slide the effect of the three hormones that are being released is by using a GLP1 activation system that I just described to you. GLP1 is activated and the insulin response is shifted from the right to the left. And that's the supporting data that then makes metabolic response more controllable, food cravings decreasing faster and to a longer lasting level. So with that, let's shift to the last piece of information that I wanted to go over with you, or to let you know that as you download this deck, you can spend more time looking at it. But what I hope I've shared with you today is we understand the underlying generational effect that changes in dietary practice and habits have resulted in the increase in prevalence of obesity. It's basically an insulin resistance problem accentuated by an increase in lack of controlled caloric intake. We know how and what mechanisms of actions we can influence to overcome that problem. And we now know, most importantly, that it's not a singular targeted symptomatic response that we're trying to generate, but a complete underlying system benefit that we must find a way to better manage and balance. And we've identified now very specific natural ingredients that, working in concert in a more complete approach, can result into the most effective, natural, healthy, total system improvement that may be possible. So with those three insights that I shared with you, let's talk a little bit about some more of the clinical insights. We have a series of clinical algorithms for those people that are interested in a natural product or even a co-therapy with prescription meds using GLP1 core solutions. And let's take a look at that. So first, the first question is who really is the right candidate and the patient candidate to look at the use of GLP1 drugs? Basically, anybody who has a BMI really of I prefer 29 to 30, but really over 26, who has glucose toxicity and diabetes, who has a resting blood glucose of 110 or higher, and obviously who are really 15 pounds or more overweight. Those are the ideal candidates of anyone who should be using GLP-1 system. We have an algorithm-based clinical protocol that allows you to be able to look at and ask usually 4 or 5 critical questions on the profile of your patient with a yes or no alternative on a decision tree and a decision approach that as a practitioner, you are in the best position to assess for your patients. And so there are protocols now that we have here for weight management and glucose control and hemoglobin A1C. And it's basically a total system, metabolic system approach that can help guide you through what are the solutions at each one of the questions you ask, what are the most appropriate solutions. We have a clinical algorithm that can be used on the therapeutic regimen based off of the use of prescription meds and the transition to, through, and off of prescription meds. And we have basically a very specific, that's just a GLP-1 a receptor agonist or a prescription med drug co-therapy with our natural product, which basically is a very important consideration when using prescription meds to avoid some of the issues, negative issues, and even complications that patients might experience on use of prescription meds. So with that as a background and highlighting, I hope some of the pieces of information that you can go back, download, and spend more time talking about. I want to summarize the key messages and key points that I hope that I've left you with, and I hope that I've been able to convince you to take a closer look at and consider when you're developing your therapeutic approach and working with patients who can derive the benefit of GLP-1 targeted use. Number one, obesity is a condition of insulin resistance and metabolic imbalance. And that's why GLP-1 and the GLP-1 hormone cascade and metabolic control is so critical to the complete and effective management of healthy weight loss. It does that by a concerted and complete way to improve insulin sensitivity and reduce weight loss. GLP-1 receptors and beta receptors are found in the digestive system and controls metabolic balance. And if you're not introducing your therapeutic effect that includes targeting the digestive system, you'll have an incomplete and less optimized therapeutic plan on GLP-1 effect. The receptors in the brain that are GLP-1 specific will increase satiation and decrease food cravings, but that's only part of the story. That's a symptomatic response if that's all you do. And there are limitations and consequences to that. GLP-1 stimulation occurs primarily in the digestive tract and is influenced by the microbiome, thereby allowing it to influence the metabolic system. The DPP-4 inhibition is an important capability and an important issue to prolong the effects of natural solutions and even to prolong the benefits of a healthy macronutrient diet. Increasing GLP-1 cascade can increase satiation and balance the metabolic and hormone response that will result in significant weight loss, over a 12-week and longer system. And natural solutions provide a healthy system benefit rather than a symptomatic response. I want to thank you for your participation today. I want to thank you for the passion that you all have in taking care and maximizing and improving the health of the patients that you see every day. And I want to let you know finally that as a nutrition company, we're here to support your efforts. We're here to answer any questions that you might have, and I'm happy to answer any questions now that you may have as a result of listening to and considering the information I provided in this presentation. Thank you.
Excellent. Thanks so much, John. Lots and lots of questions coming in, so I'm going to do my best to answer as many of them as we can. Let me see here. Let's see here. So, as far as the products that you're discussing, what are the vital nutrients products?
The vital nutrient product is called GLP1 Complete. And it has all of the components at the efficacious dose levels that I just described for you. I didn't welcome you to take and invite you to take a look at that formula. But if you're also considering other formula, I'd also suggest that not only you look at the actives, but also take the time to look at the dose level of any of the ingredients that we talked about to make sure they're at the clinically efficacious levels before you use it.
Excellent. Richard asks, one of the unfortunate side effects of too rapid weight loss is sagging skin. Do you have any advice how to prevent, especially when upregulating with the GLP-1 with supplements?
Yeah, that's always a good question. A lot of people have that, and I can't really tell you that I really know the answer to that. The surgical procedure, depending on the magnitude of the issue you're talking about, may be the best and most effective solution. But other than that, it may be worth looking at hair and skin solutions that, like collagens that you might consider. But that's a tough question that I'd suggest you talk to a bariatric colleague and see what they typically do.
Excellent. Thank you. Another question we have is, does inhibition of DPPIV have adverse effects, such as the ability to digest gluten?
Yeah, so frankly, no. And one of the things that's really interesting is that because these are natural products that basically increase the intrinsic levels of GLP-1 and the incretins or insulin, and some of the other components, they actually have a synergistic effect and a synergistic benefit. And that's really important to realize, so that there are really few to no negative effects. If anything, there may be a slowness in the gastric emptying time, but also that helps facilitate and fuel the satiating response. So even that is a positive experience.
Excellent. Let's see. Another question we have is, what's another probiotic besides Akkermansia?
Well, for the benefits use of selected probiotics that have a really well-known clinically supportive effect or decrease on inflammatory processes. The other major probiotic that does that is not only Akkermansia, but a strain called F. prudnitzii. And F. prudnitzii is little known, but it has a high rate of proliferation, particularly with resistant fibers, resistant starches. And there is some emerging data to suggest that it may actually be as and even more effective than Akkermansia. But those are the two strains that have been found in epidemiological studies and other clinical studies that have been associated with the healthiest profile and the lowest level of inflammation in people who have suffered from chronic diseases.
Excellent. Another question is, how soon before or after Akkermansia probiotic should fiber be ingested?
If you're going to take an Akkermansia probiotic, you should take these selected fibers with it. Otherwise, the chance of the probiotic itself taking hold and anchoring itself in the gut is going to be a low probability. So especially Akkermansia and F. prudnitzii, they really require a substrate source, an energy source, so they can thrive. And if you don't give that to them, like a symbiotic, they're not going to. So as soon as you start taking one of those probiotics, take resistant starch or like a partially hydrolyzed guar gum. Those are two of the most important prebiotics that will help proliferate these strains.
Excellent. That's so helpful. Does GLP-1 affect bone density at all?
Yes, it does. So it'll decrease bone loss and increase the formation of bone cells. And so that's one of the other benefits, the GLP-1 that are circulating and being metabolized in the gut and in the liver will drive. So it's still an emerging issue that's being studied with the prescription meds. So the jury's still out on that role, but for sure, natural nutritional products will have that benefit.
Are there any common side effects for GLP-1?
The only thing that practitioners in particular should always be aware of is just continue to monitor resting blood glucose, and that's easy to do. You can do it with continuous glucose monitoring, and we've not seen any cases, at least in our clinical studies, that would suggest that glucose levels have dropped to such drastic low levels that that's a problem. But it's always good, especially for patients who are obese and diabetic, to monitor in a continuous way glucose.
Excellent. And just a follow-up question. What was the name of the other probiotic besides Akkermansia? Can you spell it for us?
Yeah, I'm sorry, I always misspell this, but it's Preznitzi, Prezeunizi.
Excellent.
I think it's in the slide deck too. And if not, I'm happy on follow up to send you some email or give you some other information.
Excellent. Excellent. Well, we are at time. We're a little over, honestly. So I just want to say thank you so much to John for this presentation. So engaging and topical, right at the top of everybody's minds now. So this webinar is being recorded and it will be sent via email to you, as well as available to view at fullscript.com/webinars. If anyone has any questions, they can send them over to me at amy.regan, REGAN, at fullscript.com. And thanks so much, John. Any final thoughts as we wrap up?
No, thank you, Amy, for all that you do for these webinars, and thanks to all the participants for the privilege of your time today and sharing what I think is really an important clinical topic that's going to help a lot of patients. Thank you.
Excellent. Thank you.